call this meeting of the Montgomery County Board of Commissioners to order. It is July 21st and it is now 6:03 p.m. I'd like to congratulate Commissioner Henson on his one-year anniversary. I think he's been a commissioner with us for a year now, and he's going to ask that he provide the invocation tonight.
Thank you, Madam Chair. I appreciate that. If you would bow with me. Dear gracious Heavenly Father, we thank you for another opportunity for us to gather together to conduct the business of Montgomery County. And we ask for your blessings upon all the members of this board and all the members of the public who do have the best interests of these citizens at heart. God, right now we do ask that you just be with all the families of our citizens who are suffering from COVID-19 and from the families that are affected with loved ones that have been sick. And we just pray that you can be with us as we make these decisions to just lead, guide, and direct all of your people. And in Jesus' name I pray. Amen.
Thank you, Commissioner Henson.
Yes, ma'am.
I'll ask Mr. Woodard if he would lead us in the Pledge of Allegiance.
If you are able, please rise and join us in reciting our Pledge of Allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And I believe we do have someone that's going to speak during the public forum. So, Mr. Woodard, would you go over the rules for that, please?
I will. I believe Ms. Fowler has signed up to speak at the public forum. Ms. Fowler, citizens are allocated 3 minutes time to address the board. They'll please address your comments to the board and not to the audience, staff, or to the media. Be free to talk about anything that the board is open to legislate or free to legislate in open session. I will start the time after you give your name and address, and at the end of that 3 minutes, if you're still speaking, I'll have to let you know. Just give your name and your address for the record.
Esther Fowler, 217 Brutonville Church Street, Kansas, North Carolina, 27229. I need to, I'm here because of the new water and sewer policy. I was questioned in the county why we were paying sewer fee and we didn't, when it was not used for rental homes. If a home is rented and nobody's in it, we'd still have to pay the whole pay the same thing a person would be using if someone was living in it. I did not have the answers. I went and talked to Mary. Mary told me I needed to come before the commissioners to get the answers to the questions I have. And I wanted to know, when did the new policy start? And then, if it's for everybody, all Montgomery County or just Brutonville. And I wanted to know how will the clientele be determined? How will you determine the clientele for the new policy? Mary told me she felt that everybody in Montgomery County was using it, but I did question a few people and they said they hadn't heard of it and they were not using it. Let me see. I talked to the town of Camden, and they told me how the sewer was paid for. And it's according to the gallons of water that's used. And that's what I didn't understand. Why would some have to pay and others didn't? And why would it have to be paid if no water was being used? I realize that we do have to pay $12 to keep the water line open. But why would we have to pay $42 if no water was being used? And I do know that you might not have the answers today, but you will get them for me. And let's see. That's right this minute. That's what I basically want to know about the new policy. When did it start? How did you pick your clientele for it? Is it just for Brutonville or is it for Montgomery County?
Ms. Fowler, thank you. If you want to have a seat, I'll be glad to address that if the board.
Okay, please do.
Ms. Fowler, I'm going to take my mask off, if you don't mind, I'll stand with me.
sewer comes from the town of Cantor. As a convenience for our customers, we include one bill instead of two. And so we bill for Cantor for the sewer. The money that we collect, we pass straight to them. Their policies about rates, et cetera, for sewer is in their wheelhouse. And so I can't answer to what Cantor's policies are, rate, fee, et cetera, because we just as convenient for the customer, instead of getting two bills, one from the county for water, one from the town for sewer, we just put them on the same bill. But I can't address the water issue.
I understand what you're saying for the water and sewer that's being used, but I was basically talking about for the rental houses.
Right, yeah, I just want to make clear that I can't speak for
Okay.
Cantor and sewer, I can
I
speak
can
for water.
understand that.
About 6 years ago, the county's policy was, if I was the landlord, and let's say Commissioner Henson was my renter, and he didn't pay the water bill and ran up the water bill, the owner had to pay the water bill to get the water turned back on. So we made the landlord be responsible for their tenant. So if I rented my house to Commissioner Henson and he didn't pay the water bill for 2 months and then he bolted, in order for me to rent my house again, I had to come pay his bill. That's the way it used to be. We also had a policy that nobody could ever stop their water charge. We had some folks that when the water line came by 15 years ago, they said, I'll sign up. They never hooked up, but they said, I'll buy a tap, because they were told you can buy it now for, $100, 10 years now, maybe $500. These people signed up. They never used a drop of water, and they got charged every month. And the county policy was you could never get off, like mafia. Once you join, you're in. About 6 years ago, we changed both of those policies to be more customer friendly. We told people, if you don't want to be a customer of ours in water, you can end right now. We had some people that literally had $8,000, $10,000 bills they owed us. So they just stopped paying because, they never used the water. So we changed the policy to say that if you didn't want to be a customer, that's fine. We'll stop charging you. We also changed the policy to say, landlord, you're no longer responsible if the tenant runs up the water bill. We will hold Commissioner Henson, the renter, responsible. You can get a new tenant. But let's say in the 3 months in between, Mr. Henson leaving and Misty coming in, we made you, the owner, pay the minimum bill. And the reason was the largest, most populated area in the county is Twin Harbor Campground. We have 2,000 water customers in Twin Harbor. Come Labor Day in September, guess what? They want to go home for the winter, and they want to say, we don't want to pay the water bill anymore. We'll come back in May when the summertime gets back, and we want to start our water back. Knowing that we could not allow them to not pay us for 9 months, you have to have customers to make the water system work. We have 450 miles of water line in this county. We have many, many expenses, and so everybody has to stay in and keep paying. So that's why in the off months between renters, we make the owner responsible, just like we make the people at Twin Harbor that aren't there from September to May, we make them pay their water bill every month. So that's really the math, the only way the system can work. So we've changed the policy about 6 years ago to try not make the landlord be responsible for the tenant. And we gave people the option, if you don't want to be a customer, you can stop. But don't come back to us for 3 years and try to be a customer when you want to be a customer. If you come back if you stop your account and you come back within 3 years, we make you claw back and pay some money back to us. So we did change the policy, the board did, and again, it's been about 6 years ago, I don't remember the exact date. But those changes, I think, were a lot more customer friendly. But at the end of the day, we have a multi-million-dollar water system, and we need customers. We've got to have revenue in order to keep that rate low. The board, they've tried to keep that minimum bill for water as low as they can, because we know there's a lot of people on fixed income. And if we don't make folks pay for the service, then that bill's gonna go up. And so that was what the board considered through all that.
I do understand the point that you're saying, the water line has to stay open. And I think that minimum is $12. But then when I looked into what Canada was doing, Troy buys sewer for Camden, right? I mean, for the Montgomery County people that's not in the city of Camden, the town of Camden. Okay, that's like $42. And the way they sell it is by the gallons of water used. I can see paying something to keep the water line open. But if I'm not using the sewer, why am I paying the sewer fee also?
Yeah, like I
That's
said,
$52. If I had 10 houses, rental houses empty, I gotta pay $52 for each house. And nobody's using it.
yeah, we, the county, have a much lower rate if there's no usage. Again, I can't speak to Candor. I can call them and find out if they're considering a much lower monthly rate if you're not using it. I'll be glad to do that. But really, that's out of our control. That's a city system and the county, you know,
Well,
just,
it's Montgomery County that I'm concerned about. Camden, I was much different from Montgomery County. Montgomery County, if you tell them that you don't want it, you can't use the water, if you can't use the water right now, they'll cut it down for 2 months free. But in the city, in Montgomery County itself, you have to pay the water and the sewer, and you're not using either one. That's the county.
no, it's.
Unless I misunderstood
Yeah,
it.
the county has no sewer, treatment facility. The sewer treatment facilities in the county belong to the town of Troy, town of Mount Gilead, Star, Bisco, and Canton.
Plus Handy.
Yes, I'm sorry, and then Handy Sanitary District in the north. But there's 2 areas in the county that are outside the city, Brutonville and down here.
Okay, I'm in Brookville.
Right.
Okay.
That sewer line runs into their sewer system.
Into Camden.
Into Camden.
Uh-huh.
The county agreed, if that line breaks from the city limits to your house, guess who has to pay for it?
The county.
The county.
Mhm.
How much money is the county collecting off the sewer bill?
The minimum.
No, ma'am, we're not getting any. We give all that money to Canada. Since they don't treat the sewer, they're paying the cost. The county is eating the cost for the people in Brutonville and down here. Any repairs we have to pay for, but we're not getting any money. That's their policy. Troy would not take the folks down here. Candor wouldn't take the folks down there, so the county had to step in because the sewer systems were failing and said, you know, we'll pay for it. And so I understand your concern, and I'll talk to the folks in Candor about considering a lower non-use fee. But that's all I can do, just ask, because we're kind of like you are. We're just the person getting the service from them.
Because I know if I had 10 houses or 8 houses, I would be able to pay $52 a month per house, per empty house. I would.
I understand.
And I do appreciate you down in Boston.
Yes, ma'am.
And you can call me or something when you get the answers. Or
And for all clarity, since Tammy will fact check me on it, the county mails the bill to the customer. We include the town of Candor sewer fee on our bill. We pay for all the printing, we pay for all the postage, we pay for all the staff to handle it. We do, the county gets $1 for Candor for every person we bill for to cover the postage and part of the expense. But I said we get nothing, but
And the only thing I understood that you got, that Campbell got was per gallon, sewer per gallon of water that you use. That's what they get. That's what they said.
yeah, the way the bill works, they tie the amount of water you use to how much sewer you use, and then they have their own fee structure. And so they tell us what to charge you, and we put it on our bill every month.
Okay, now the clientele for that, is that all Montgomery County except for the towns?
Yeah, the only places in the county that have sewer that are not in town is Fruitville down here. That's the only two places.
And
And Handy, and Twin Harbor's the same way. Twin Harbor at the lake, that's Mount Gilead. But the difference is Mount Gilead owns the line to Twin Harbor, whereas the county owns the line once you leave Troy, and the county owns the line once you leave Canada. County does not own the line up in Handy.
Now, the line, one of the sewer lines behind Blake's Restaurant that Canada has, it's partially on my property, but it was a mistake. We don't charge. We know that it was a mistake when they put it on, Coleman told us it was a mistake, that they accidentally put it on us. We don't charge, but I do question why the people have to pay so much when they're not using it.
Thank you.
Thank you. Is that it, sir?
Yes, ma'am.
Okay,
Be
thank you.
safe, thank you.
Thank you.
thank you.
I need to back up here 1 minute. I need to get approval of our agenda tonight. This is the main agenda. Do I have a motion to approve our agenda?
Move to approve the agenda.
Motion by Commissioner Henson. Do I have a second?
Second.
Second by Commissioner Mack. All in favor?
Aye.
Any opposed? Okay, thank you. Okay, we're moving on down to our consent agenda. And I believe
Chairman, if I
Mr.
may,
Woodard has
just
a,
one error I made before the board votes to approve the consent agenda. Item number 4, the designation of voting delegate to the NCACC annual conference. Commissioner Matheny has faithfully served in that capacity as our representative to the North Carolina Association of County Commissioners, and we inadvertently forgot to fill his name in on that form. Since he has served that all the years of his service here, that was inadvertent on our part, but the consent agenda should designate Commissioner Matheny as that voting delegate.
any questions about that from commissioners? Okay, thank you. Anything else about the consent agenda before do I have a motion to approve it?
Move to approve the consent.
With the
agenda.
revision? Pardon?
Move to approve.
Okay, do I have a second?
I'll second.
All in favor?
Aye.
Any opposed? Okay, consent agenda has been approved. Okay, now our next presentation is an update on the coronavirus, and I believe Director Mary Perez Baldwin is going to, and maybe Robbie, I don't know who's going to do that.
Robbie and Mary are going to give us an update. We certainly appreciate all they're doing, and it is a tremendous amount. What they're required to do is the health department, contact tracing, what the health department and the towns and the county are doing for the testing across the county, and Robbie has really helped spearhead that effort, so I certainly appreciate what y'all are doing. I'll let them speak to the events in particular. We are seeing now a bottleneck at the company that actually conducts the test. We send the swabs in, and they test for 4 strands to see if it is positive for coronavirus. Robbie, unless I'm mistaken, we have not received any results back from that company since July 8th.
We have received some of the tests back, but we haven't received any complete dates since July 8th. That is correct. We did receive everything back for July the 10th, but we didn't receive anything for the 8th or the 9th.
The testing we've done the last 12 days, we don't have results.
Right.
So we really,
According to Amy in the lab, with the health department, she's talked with Quest multiple times, and as of today, they have run out of reagent that they use to test the samples with. So everything that we have sent, I think they're sitting on like 211 of our samples that we have sent. 230. So 230 of our samples are sitting in a freezer at Quest Laboratories waiting to be to be tested when they get the reagent to test them with.
I know we've talked about looking at another provider. We obviously can't go get what's in their freezer right now, but moving forward, are we looking to try to contract with somebody else?
Well, all the labs are in the same situation. They're running out of reagents to test their specimens with. If we requested another lab to test our samples, it would take at least 2 weeks to set that up. So we would still be about 2 weeks behind. And if we only requested another lab to only test our COVID specimens and not what the lab normally does with, all the labs that they do, then there's a possibility that Quest would say, well, if you're going to do the testing with that lab, we'll just end our association with you all, and then Mary and them would have to find a lab to do their other testing with. So it's a kind of a catch-22 right now. But every lab is in the same situation. Every lab is having problems getting the reagent to test the specimen.
And what, I know in situations like this, we look to the state looks to the feds. I mean, that's the circle here, but I mean, are we getting any indication as to what the state may be doing? I know that y'all had mentioned to me that the state wanted to come and set up a testing site of their own between Gander and Jackson Springs to test for the antibodies and that has not come to fruition yet, has it?
I'm going to talk about it like that.
All right, well, you move forward.
Okay. Just Mary, just to date, we have tested 981
Thank you.
people. Now, some of those are multiple, but we have performed 981 tests today. As of today.
The multiples that we test, if they are positive more than once, they're not recorded online as being duplicates, are they?
No, sir.
Okay.
Mary keeps up with those.
Right.
And they're only counting once.
Yep, okay, that's good. I just want that to be clear, that these aren't duplicates.
But we have tested them.
Right, more than once.
Times, so they're only counting once.
Yeah, they're not going on our website to say this, two or three positive results from the same person to skew the numbers. Okay, good. Thank you, Robbie.
Okay, so I just gave you a copy of the updated map. We updated it today. And it shows the increase in cases. We're at 514 as of today. We have 333 that are active cases. That means that they are still on self-isolation of quarantine. And then as of today, we now have 13 deaths. We had 2 that came in today. Also included with the map, it just shows you North Carolina cases and North Carolina deaths compared to our cases and our active cases and our county deaths. And then there's a total number of Montgomery County tests that have been conducted to date. Any questions?
Mary, can you tell us anything about the deaths, about the demographics of the deaths?
Both of the deceased were hospitalized. Both of them had, they were older. They both had respiratory issues. One of them went into the hospital. Of course, once they're admitted into the hospital, family really can't come in. This particular person's daughter was in another county, and they called her to tell her that her mother was getting worse. And before she could get to the hospital, her mother had passed. So they had to call her on the way in to tell her that. The other lady that passed, she made the decision that she wanted to come off the respirator, and she was ready to go. So they were both over. And they had some comorbidities, some underlying health issues.
Which hospital is it?
They were both at Moore Regional.
They're not treating any patients at our hospital,
I'm sorry?
are they treating any patients at Montgomery?
I think pretty much they're sending them all to Moore, because usually when they get to the point of needing hospitalization, they need to be somewhere where they can be intubated if needed.
Okay, thank you.
Okay, the next sheet is just COVID data. And it shows again the positive cases, 514 with a total of 13 deaths, 168 have recovered. And really, I feel that there's more than that. We just have not had enough time to call them and say, are you doing good? Well, you can come on. Just because the cases are coming in, we get anywhere from 10 to 20 new cases a day. Because not only are we getting cases from the drive-through sites, but every provider in the county. We're getting positive tests from Asheboro, from, of course, Moore County. We're getting them from the Star Clinic. We're getting them from CVS in Aberdeen. So we're getting positive tests all the time, besides just the ones that are being done at the drive-through clinics in Montgomery County.
But these are Montgomery County people, they just work in the other counties or something, but they are Montgomery County residents?
They are. That hospitalization is 11. And again, we still have 333 that are under isolation, but as I said before, I'm sure there's some that can come off, because we just haven't had an opportunity to reach out to them. And we've had 20 new cases since the information was updated on the site. The other thing that's new that we decided to do, if you go to the next page, is we're doing a daily new cases. The graph shows the blue line is the new cases, and then the line that says 5-day moving average, that kind of shows you how the pattern is going for cases on a daily basis. Then we have the county cases by age, and we're trending right along with the state. I think they're seeing a lot of cases more in that age 25 to 49, which is our younger people, because they are going to do what they do. They're going to go out and they're going to have fun. It's summertime. Then there's the case count by gender, and we can see that female 54% are testing positive, and 46% of males are testing positive. We did notice in the last 2 weeks, or I should say since the 4th of July, there has been an increase in African Americans that are testing positive. That count is now 11%. The Latinx or Hispanic population still is highest at 55%. White is 32%, and Asian is 2%. And then the next page shows you a graph of the case statuses. The total cases that's supposed to be a green at the top, and the purple are the number on isolation, the red is the number recovered, and then the goldenrod color is the number of deaths. graph that's there, it has tables. It has table 1, table 2, and table 3. Table 1 shows the test results for Montgomery County residents and non-residents. Among Montgomery County residents, 15.1% of the tests have been positive, have had positive results, while 17.5% of non-residents have received positive results. However, if you look at the pi 0.3164, it indicates that the two values are not statistically different at the 95% confidence level. Table 2 includes tests conducted that are still pending and separates those for individuals who receive multiple positives. And I'm going to share with you the information that, the new guidance that we got yesterday from CDC and Department of Health and Human Services, because they're saying now that there's no point in continuing to test people after they went past their, it used to be 14 days, but now they've changed the guidance to 10 days. So there's no point in continuing to test them unless they have some kind of underlying disease that they are immunosuppressed. So that changed the guidance a little bit on that. But we have had people that have had multiple tests done. That table shows that 10.3% of unique residents being tested at drive-through testing receive a positive test result. Table 3 shows that 86.6% of drive-through testing participants are county residents, with 123 total non-residents being tested, while 920 individuals have been tested at Montgomery County drive-through testing sites. 797 of these were residents. And regarding the 111 positive results, 93 of these were for Montgomery County residents and 82 were unique positives, which means they tested positive one time. Any questions so far?
Has
Then I
there
have-
been any further dialogue with the Hispanic community as well?
I'm sorry?
Any further dialogue with the Hispanic community?
I spoke with one of the pastors right before I came up, around 5, and he wants to know if we can meet next Tuesday at 6:30, and I said that I would ask you. So they are still interested in meeting. We do have a contract person that came on to help us, and she is well known in the Hispanic community, and they trust her, and I think it will help us to really get them educated as to exactly, what they need to do to stop the spread. So that's what we're hoping. And then the other pie charts that are on here, it just shows basically the same thing that I said. I'm not going to go over it unless you have questions. I don't want to take up a whole lot of the time. Just have some raw data on residency status and test results by residency, and pretty much that's all.
In your professional opinion, should we reevaluate our continuity of testing and begin to shift more towards education of stopping the spread? If our results are taking more than 10 days to come back in, does it serve a purpose to know?
Okay, so I just want to explain a little bit about what's going on with our specimens.
Mm-hmm.
So I think not just the lab that we're using, not just Quest, but LabCorp, I don't think they were ready for this amount of testing.
The influx.
They just weren't ready for it. And I think they've all been overwhelmed. I know that the lab that we use, Quest, they have sent our specimens to Virginia, Atlanta, as well as Greensboro.
Okay.
And that's because there's a high volume of tests that are going on. And we have to understand that we're not the only county that's using Quest. We're not the only facility or whatever that's using Quest. So I think Robbie mentioned, or I may have mentioned, that there are 230 tests pending right now because of the shortage of the reagent, which is a lot. The reagent is on back order. This is what the state has been sharing with us. We did receive results for 10 samples that were done on the 10th of July. And we're still waiting on results from tests from the 8th, the 9th, and the 13th through the 17th. So our district representative, we reached out to her, and she said, well, I'm going to try to help you all circumvent, and what I want you to do is use these priority cards when we send our labs to stick this in so that they will be flagged as being a priority. Priority 1 is hospitalized patients or symptomatic healthcare workers. Priority 2 is symptomatic patients in long-term care facilities, symptomatic patients over age 65, symptomatic patients with underlying conditions, and symptomatic first responders. And then priority 3 is symptomatic critical infrastructure workers.
Right.
Symptomatic individuals who do not meet priority 1 or priority 2, and asymptomatic healthcare workers and first responders. So she's hoping that this will help us circumvent in the future and get our tests put up front.
Yeah, I agree, it's not a county issue. I just don't think that these prolonged wait periods are consistent with the county's goal to test 15% of the county population to slow the infection rate.
Right.
So it's just, we have to figure out a way to move forward.
Commissioner, if I could piggyback off that, you mentioned, Mary, that you were going to talk about the state and them coming in to test. I mean,
Right.
presumably the state's not using LabCorp, that they're using their own facilities.
I'm not sure who the state is using because I have not gotten clear information from them. But I know that Dr. Vane has spoke to me about using MACO. And MACO is a locally owned lab. However, they do well with a few tests here and a few tests there. The hospital uses them. But we reached out to another health department who had used MACO. And they have the same issues that we have because they can't handle that big load of tests.
But has the state given us any more? I mean, they were going to come, set up a testing site. Are they still coming?
They're still coming. So it was July 7th when the state talked to us and they released a press release about supporting communities and expanding free testing in historically marginalized populations through CHAMP. And that stands for Community High Priority and Marginalized Populations. So the zip codes that they pulled out of our county was 27229 and 27242. So that borders not only Montgomery County, but Moore County and part of Richmond County. What we're waiting for right now is they put out an RFQ, and they're still waiting to get...
Waiting for LabCorp bill.
Exactly. So they're still waiting to see who they can get, what vendor is going to get that area.
So, looking at what we're doing, do you think, because the backlog, all the problems, should we limit our testing to people who are exhibiting symptoms? And so when they come get tested, even though it still may be a delay, we can tell them, you need to quarantine yourself if you're having symptoms.
Right.
And try to relieve the pressure on the system by not sending in all these asymptomatic. You just, the commissioner just asked about, these deaths, if people with underlying health issues.
Right.
Should we not maybe, in order to relieve the overall pressure, say, unless you're at risk or exhibiting symptoms, we don't need to test asymptomatic healthy people for right now?
We can do that.
I think that there has to be some sort of shift because what we're doing now just is waiting. And by the time these people get their results, it's been 2 weeks.
And I think our governor had good intentions when he wanted everybody to be tested.
But, right, and this is something the
I
county...
think what happened is that they did not consider that our labs would not be able
we couldn't foresee this. We couldn't foresee the backtrack, so it's at no fault to the health department or the increase in testing. I mean, it was, by all means, the best effort we could make.
I'm concerned that the county, on our website, we're tracking what we are doing in the health department. And the percentages of positives going to go down because we're keep adding the number of people being tested, no results are coming back.
I see it.
And you're going to give some false hope.
Smoke screen.
And so, it with various concerns, I'd like to make a recommendation to the board that for our testing, that we limit it or to people who are at-risk populations or exhibiting symptoms, people that should be quarantining, to try to relieve pressure on their overall system until they get their agent or whatever you call that they need. That until they're able to process tests timely, we try to not exacerbate the problem.
I'm reluctant to dial back on that, but because I think identifying the asymptomatic is really the secret to success. It's the asymptomatic that are spreading it in large.
Yeah, it's just, when we wait 12 days to get the results back.
But it's a national problem that is going to have to be solved nationally. I mean, we could back off for a few days, but I mean, as soon as we start seeing results improve, I think we ought to be testing out as many people as we can.
Yeah, that was my point. Until they can start delivering them 3-4 business days, we'll back off. As soon as they are able to respond within 3 or 4 business days, we'll go back to wide open.
I mean, in our county's case, I think the numbers indicate we're going to have to deal with the Hispanic community and figure out why there's such a high amount of the cases in their community. I think we know some of the underlying reasons, but we need to get with them and see if there's anything we can do to alleviate some of these. I mean, for example, some of the counties are paying to isolate positive people in hotels and motels. And I think that's probably one of the, we look at 54% of the cases and 19% of the population, then clearly when you have 8 or 10 people living in the same house and one of them's positive, then
Exactly.
the other 9 are going to follow quickly behind.
That's right. And that's exactly what's happening.
So I do think it is worth a shift to not necessarily stop the testing, but to pause it, and then to shift some focus towards education and PPE.
Well, I think you need to do both. I mean,
Absolutely, it's a joint effort.
Got to do both, and there's nothing you can do relative to the shortage of reagents until the reagents are available.
Yeah,
And that's a nationwide, that's not just a.
It's not a
regional
county
problem,
issue.
That's
No.
nationwide.
Right, it is nationwide. They just weren't ready.
Right,
Mhm.
right, you're right.
Well, do I hear a recommendation then that we back off for just a little bit till they can kind of get the test caught up?
Well, we're going to encourage people to be tested, the ones that are at risk and showing signs. The ones that we're encouraging to quarantine. Not necessarily turn people away, but is the message out to the public. Robbie's meeting with the towns, having people to sign up. Folks are calling in, try to make an appointment. You know, at this time, there's a backlog at the lab. We've not received results in 12 days. Unless you are exhibiting symptoms or at risk, we ask you to wait until the backlog, because Mayor, I think it's safe to say if you're a relatively healthy person, there's exceptions obviously, but, you have a much better chance.
Right.
Robbie?
That's probably a good concept, but the downside to that is you tell them to back, delay. You might decide never to come back. That's my concern.
Robbie, you've been on every testing site. You wish to be heard about this?
I'm good with whatever you decide. If that's what, if you decide to cut back, that's what we'll start telling people tomorrow at the testing site in Gander. And I'll relay that to, all the town, offices, for people that call in to tell them that unless they're, exhibiting signs or symptoms, there's really no need for them to test.
Yeah.
And with the people that drive up, will tell them the same thing. And,
Yeah.
you know,
I would make sure you tell us because the
Of the
lab
shortage.
process is because of the
Yeah,
natural shortage.
yeah, absolutely.
I mean, I think whatever we do, I imagine this lab is, we're a small percentage of their customers. And us dialing back is not gonna make that much difference.
I think you're right.
It's the asymptomatic person who goes and infects his grandma that is causing the deaths. And that's the ones we need to identify and isolate.
I do think a lower scale of testing would give us a more accurate reflection of numbers, since we aren't getting any results back though, because you said we're putting up that we're having all these tests, but if we haven't got any positives, the numbers seem to be getting lower, right?
Well, I think you have to be smart enough to know what the numbers tell you.
Mm-hmm.
And
I think
Yeah, I
it's,
mean, it's just for consideration. I mean, you know, yes, I agree with Commissioner Thune. We, as with everything we do, is just a drop in the bucket of the overall.
Yeah.
But we stepped up and did masks before the state did masks. We stepped up and did remote testing before everybody else was doing remote testing. It's just trying to look at doing our part. You know, I don't want to discourage people either. I've just thrown it out there for consideration that if we are reaching these backlogs and people are calling into the health departments, I'm sure they are, with where's my test, and, you know, that we try to get the word out. You know, there's a national shortage that you know, and so we right now need to focus on at-risk and symptomatic people and you know, that was just a suggestion.
yeah. I'm skeptical of having the team telling people to back off. Because once you tell them to back off, then the word is gonna get out that there's no need of going because you're not gonna get tested. And when that occurs, then we have a lot of people not going. So even though we got the backlog, it's better to have the test and have the test in the hopper than not to have the test and wait till we get the reagents and the lab staffed up to do the testing. So it's better to have the data, the information there so that they can do the test at a later date, even if they overcome the virus by the time they get the results back.
And now that they've changed the guidance, where it was 14 days of isolation, now it's just 10 days, 24 hours without a temperature, and they're on their way. And I see a lot of workplaces now won't let their employees come back to work until they've had a negative test, which is why we keep getting the positive test. So the guidance now is that you don't need to retest for at least 3 months. If somebody needs to be retested, you need to wait 3 months. So it changes it just changes all the time. The guidance changes all the time.
Gary, it sounds like that, you know, there's pros and cons to everything.
Right.
We will keep going like we're going, you know, and keep voicing our concerns to our state representatives to try to get us the resources, and hopefully they'll get the RFQ back quickly on the Kansas site. Hopefully whoever wins that RFQ has lab facilities in-house that they can, and we can just send everybody to Kansas way, even though you don't live in 27242, you know, 371 and 242.
Well, their plan is to do 1,000 a day. 1,000 a week. They want to do big numbers anyway.
And we will keep our fingers crossed and push for that. Robbie, you want to add anything?
Okay, well, thank you,
Thank
Dave,
y'all.
for what you're doing and for your staff and all that they're doing.
No doubt.
Well, Chairman, the next thing, presentation is an update on another unfortunate occurrence here in the county, and that is algae blooms. For the first time ever, we are experiencing an algae bloom. Eric Johnson, who's the water plant supervisor here, Eric, if you want to come up and just give the board a brief update on this never before seen algae, and it's my understanding that it's not harmful to folks. It leaves a nasty taste of the water, as we all know, and a discoloration. But if you'll tell us what you and your folks are doing about that, and what we're waiting on to fix the problem. I think you got the solution in hand.
We do. We currently have submitted for a permit to feed activated carbon at the water treatment facility. We have done some jar testing, and we're going to continue to do testing throughout the week to make sure this is going to work. As of the last 2 days of jar testing, it's showing that this is going to work. It is taking the taste and odor out. But the only setback currently is getting approval from the state. With COVID-19, they're working remotely and things are moving very slowly. They are trying to get us the permit as quickly as possible, but it is going to be a timely manner before we see this permit. Right now, currently, my hands are tied. Unfortunately, we are going to continue to have this problem until I can get the approval to start feeding this activated carbon.
Not that you haven't tried other steps.
We have tried potassium permanganate. Unfortunately, that has not helped us out at all. We have tried doing things at the reservoir. We went from the lower intake to the upper intake, trying to get more quality water on top. It seemed to help. It's not as strong. The calls have come down to maybe 1 or 2 a day, and some of those calls are the same people just asking, when is this going to stop? Currently, I don't have a date or a time frame when this is going to stop. Unfortunately, it's going to be like this probably for the next few weeks.
And Eric, it's our understanding from the chemist and the botanist that this algae is the result of higher climate temperatures, the less is permitted in the water because we've not had rain, and that this algae is growing deeper under the surface in slower moving water is what's causing the proliferation. Normally the sunlight wouldn't get down that far to allow this thing to go, and since the water is moving slower, lower, that's what's causing the problem.
That's correct. And when that happens, that's considered in our terms a turnover. The reservoir is turning over. Unfortunately, it's turning over more often than we have experienced in the past. So there's no real solution at this current time, and it's frustrating on my behalf, being the superintendent, that this is going on and the public's dealing with this. Because it's in the state's hands at this time. The state and I talk 2 or 3 times a day. They reach out to me, I reach out to those folks, and it's just a slow moving process.
But as far as we know, there's no danger to.
There is no danger. The water is safe to consume. We are meeting state standards above and beyond what we need to meet. The production is not by any means slowing down. We are still producing the same amount of water at the same rate. It's just the taste and the odor is there.
The chlorine's killing the algae blooms.
Oh, I smell the chlorine. I know it's there.
It's there.
Okay.
Any other questions or concerns? Feel free.
Eric's also working, we've heard from the feds about other stimulus packages that may come about spurring the economy back, to try to help local governments that they're looking to fund water sewer projects for towns and counties as part of the stimulus package to get folks back to working, et cetera, to relieve some of the burden on local governments that are seeing revenue shortfalls. And so one of the things that Eric is looking at is an aeration system that you would put in at the raw water that would in effect eliminate the algae before you poured it into the water plant to treat. Now that is a high dollar addition, but again, with the climate, with everything else, we're probably going to see things that we've not seen before moving forward. And if we can get the type of money that something like that would take, we just wanted to put it on the radar, so when the commissioners are picking projects, that may be one that you want to pick if we can get some federal money available.
Okay.
And by using that, there will be no additional chemicals needed, so we can probably eventually maybe not have to feed this new chemical that we're looking to add on, which is a great plus, not only for the operators and myself, but also for the community. Matthew had stated, times have changed. When we get rain, it's several inches at a time. We're seeing floods, we're seeing water in places that we've never seen it before. And with the heat waves that are here, it seems like they're going to be here to stay for a while, and that does not help with water quality at all.
Now, do you have the algae in the pool area where you're pulling the water from?
The algae is the entire area of the lake. And yes, it is where we are pulling it from.
What if you put a coffer dam in and how the low flow just go into the pool area? You blocked out a pool. I've seen situations where they would use like rubber, like big rubber balloons, but they're extremely strong.
So,
And the water flows over and into the pool area. The low flow
okay.
flows into the pool area, and that's where you pull the water. Would something like that help?
Well, unfortunately, we are roughly 20 feet deep for where we're pulling from,
Okay.
and even deeper than that, so that's probably
Yeah, you're
not
right.
feasible.
That
And
kills that thought.
it does.
Yeah, yeah.
Unfortunately, that is a great idea, but it's not feasible for us.
Right, okay.
Okay.
Last time they had the stimulus program, 10 or 12 years ago, the big deal was shovel-ready projects.
Oh, yeah.
And so some systems, the bigger systems in the state, when they hadn't had the engineering done, they had programs sitting on the shelf, quote, shovel-ready. That aeration system sounds like it'd be not too big an engineering effort, would it? In order to develop, get it ready to bid out.
That's correct. We currently have made contact with our engineer, and they are currently looking at a figure and a timeframe when this can happen. So that is in the process right now as
I
we
was
speak.
gonna say, we might wanna have them go ahead and engineer it so it'd be quote, shovel-ready when the
Okay.
money's available.
And that's why we had a bypass, because it was on the shelf, ready to go. And the federal government does. I mean, it's unique, going back to what Jim said. Those shovel-ready projects are the ones that get funded first.
Okay, we'll keep that idea moving and see where we end up with.
I appreciate your efforts there, thank you.
Yeah, thank you.
Thank you.
And of course, just addition to that, Booster Pump Station 2, we're getting ready to award the contract, or ask the board to award the contract for Booster Pump Station 1. Booster Pump Station 2 definitely needs rehab. That's on the shelf, ready to go. We, the bids were twice what the engineering estimates were, while we're not able to do BPS2, but that one's definitely on the shelf, isn't it?
It is, and it's currently an ongoing issue. We spend a lot of time there, putting Band-Aids on things. The guys do a heck of a job keeping it moving and keeping it going, but the time's coming that we are gonna have to do something there sooner than later.
Thank you.
Thank you.
Thank you.
Chairman, the next item that I have on the agenda is the appointment for a commissioner appointee to the Montgomery Community College Board of Trustees. The Board of Commissioners appoint 4 members of the 12-member MCC Board of Trustees. We received word from Paula Cogan that she did not want to be reappointed to the board. As the board has in their packet, we solicited applications from the public. We received 4 applications, 4 very good applicants, I might add. And so that was very encouraging to see that folks want to serve and work with the college. Chairman Robinson and I sat down with the community college chair, Claudia Bullpike, to discuss the applications. The College Board of Trustees, as expressed through Ms. Bullpike, was their overarching concern was diversity on the board. And not just geographical diversity, but also race. And so Paula Covington was the only minority African-American member on the board, and so that was their overriding concern, and we got a very good application from Ms. Tawanda Bennett to be that. And so the chairman of the Board of Trustees, their recommendation to you, the Board of Commissioners, was to appoint Tawanda Bennett. I will add that we had another very good applicant who was a doctor. And of course, one of the MCC's predominant programs are medical sciences. They have medical assisting and dental assisting and CNA and LPN and now RN. And so Dr. Jones had put in an application, and as you read his application, his parents were founding employees at the community college back in the 60s. And so he, at least on paper, would make a great trustee. It so happened that one of the Board of Ed's appointees, Dr. McKinnon, in Mount Gilead, has stepped down from the board. And so Ms. Bullseye, Chairman Robinson and I sent that application over to the Board of Ed for them to consider it as one of their appointees. And so I did want to point that out, that action has been taken. But again, thanks to all four of those people. I know the board is appreciative of anybody who's willing to serve Montgomery County. But I'll be glad to answer any questions, but the recommendation is to appoint Wanda Bennett to the Montgomery Community College Board of Trustees.
Anyone have any questions or comments? Do I have a motion?
I move to appoint Tawanda Bennett to the Montgomery Community College Board of Trustees.
A motion by Commissioner Henson. Do I have a second?
I'll second that motion.
Second by Commissioner Mack. All in favor?
Aye.
Any opposed? Okay, welcome, Tawanda.
The next item, action item, is to award the construction contract to Gilbert Engineering for Booster Pump Station 1 rehabilitation. $1,885,620. That resolution is in your board packet. Again, we received grant funds to help offset this. We wanted to do Booster Pump Stations 1 and 2 as part of that rehab, but the bids came in so high, in effect double for each one, that we asked the state if we could combine the grant money to do the most urgent one, which was Booster Pump Station 1. The state agreed. We also, the board voted to delay and rebid this project for hoping for lower costs. This second round of bidding did realize some lower costs, and the bids were lower, so that was a good decision by the board. But the recommendation is to award Booster Pump Station 1 rehabilitation contract to Gilbert Engineering at a price of $1,885,620.
Okay, do I have a motion to adopt the resolution?
Move to adopt the resolution to award the rehab project for Booster Station 1.
Motion by Commissioner Matheny. Do we have a second?
Second that motion.
Second by Commissioner Mack. Any questions or comments? All in favor?
Aye.
Any opposed? Motion passed.
The last action item on the agenda, the findings by the Board of Equalization and Review. 2020 is a rebound year for Montgomery County, and so the Board of Equalization and Review has been in session. They adjourned this afternoon about 5:45. Unfortunately, right now, the tax office is having to make some adjustments from those meetings, and so I'm going to ask that this item be tabled and presented to the Board of Commissioners at the August meeting.
Okay.
The last item on the agenda is the county report. Because of COVID-19, I have asked staff not to come to the commissioners' meeting in the interest of everybody's safety, but they are continuing to do the work of the county and submitting their reports to the commissioners each month. But I'll be glad to answer any questions that I can about the county reports if there are any. If not, that's all I have.
Anyone have any questions about the county reports or anything else or comments before we adjourn? If not, do I have a motion to adjourn?
Motion to adjourn.
Motion by Commissioner Henson to adjourn. Do I have a second?
Second.
Second by Commissioner Mack. All in favor?
Aye.
Opposed? Okay, thank you, everybody.